Hi, everybody. This is John Lingen from the National Clearinghouse on Homeless Youth and Families. We want to thank you all on behalf of FISB and ASPE for joining us for today's webinar, Connecting the Dots. We see that a lot of people are coming in, more folks every second here, so we are going to start in just a couple minutes, probably about 2:35, just to allow everybody to come in and make sure that nobody misses it for any reason at all. So hang tight with us. Thanks so much. And we will begin promptly at 2:35. Thank you everyone for joining for today's webinar, Connecting the Dots. I see that more folks are coming in every second, so we are going to give it just a couple more minutes here before we start in earnest. We will kick off with our speakers and this event at 2:35 exactly. So thank you for joining us so far, and just hang on tight so we can make sure everybody is in and seated, as it were. Thanks everyone for joining. Just going to do about a 1-minute warning here before we get started. I see some more folks are trickling in. We want to make sure everyone is in before we get started for real. So 1-minute warning here. Thank you again. Okay, thank you all so much. I think we've reached max capacity here, and I'll turn it over to my colleague, Helga Lust. Helga, get us started. Thanks so much.
Thank you, John, and good afternoon, everyone. I'm Helga Lust with the National Clearinghouse on Homeless Youth and Families, and we thank you for joining the Connecting the Dots, Using Data to Measure Social Capital and Build Social Connections for Vulnerable Youth webinar. Please note that we are recording this webinar and will notify you when the recording becomes available online. If you have questions during the presentations, please use the questions section in the right navigation rail, and we'll do our best to get to as many as possible. If your question is directed to a particular presenter, please include that as well. Now it is my pleasure to introduce Commissioner Darling. Elizabeth Darling is the Commissioner at the Administration on Children, Youth, and Families, ACYF, at the Administration on Children and Families, ACF, at the U.S. Department of Health and Human Services. ACYF has two bureaus, the Children's Bureau and the Family and Youth Services Bureau. She also serves as the Associate Commissioner at the Family and Youth Services Bureau within ACYF. Commissioner Darling, thank you so much for joining us.
It's my pleasure. Thank you and good afternoon, everybody. I'm Elizabeth Darling, and I serve as the Commissioner for the Administration on Children, Youth, and Families here at HHS. I'm also acting Commissioner, as Helga said, for the Family and Youth Services Bureau. So it's my pleasure to welcome each of you to our event today, Connecting the Dots Using Data to Measure Social Capital and to Build Social Connections for Vulnerable Youth. This event is a collaborative effort between the Family and Youth Services Bureau and the Office of the Assistant Secretary for Planning and Evaluation. We're pleased to have Laura Erickson and Sofi Martinez from ASPE to join the discussion. They'll be talking about the benefits of social capital and how to build that kind of social capital in youth serving programs. We also welcome Anisha Chablani-Medley, Chief Program Officer of Roca Incorporated. She will describe how her organization is incorporating social capital into supporting vulnerable youth. Social capital refers to the connections, networks, and relationships that we all have, and the ways that these connections can help individuals succeed in life, especially at-risk young people. Research shows us that youth who have access to permanent connections, social networks, and caring relationships are much more likely to thrive. However, there's very little research about how those programs can more intentionally use and measure these social connections and their impact on youth. So today, we'll hear about how to use data to measure social capital and to build permanent connections for vulnerable youth. As workers in the youth services field, we know how important it is for young people to feel connected socially. And in this time of COVID, we know how important that is for all of us. Lives can be changed by the counsel and the joy of good friends and family and the guidance of mentors and community networks. These connections can also be the means to a job or even the means to an apartment, facilitating a young person's growth to independence. So, how do we ensure that young people expand their opportunities through effective relationships with peers, caring adults, and social networks? We're going to find out a little bit more about that today. More and more, we can rely on data to ensure that these social connections and these strategies actually work for the youth that we are working with. This is one of the reasons that we keep our focus on measurement and accuracy so that we can really understand what makes these young people's lives better and strive toward that. That's also the core of ACYF's mission, proven best practices for fundamental issues to promote the well-being of youth, their families, and communities across the country. And with that, I'm happy to turn over the event to Brenda Destro, ASPE's Deputy Assistant Secretary for Planning and Evaluation. Besides being the Deputy Assistant Secretary for ASPE, she's currently fulfilling the responsibilities of the Assistant Secretary and the Principal Deputy Assistant Secretary for ASPE. Previously, she served as a policy advisor to the Assistant Secretary for Health here at HHS, and she was also a public health advisor to both the U.S. House and the Senate. Brenda, it's my pleasure to invite you to speak to us today. Thank you so much.
Thank you, Commissioner Darling, and thank you all for taking the time to join this important webinar discussion. I know you'll all agree with me that we have learned so much from the experience and dedication of our FISB colleagues and from the FISB grantees. Social capital has been important to our work at ASPE. Over the past 2 years, we've engaged providers, researchers, and others, and we've learned a lot about the power of social capital and how positive relationships can bring about change to those who've been traumatized and lost trust, including the children and teens that you serve. And what we have learned is that positive social capital can lead to both tangible and intangible support for some of our highest risk families and youth. It creates a psychological anchor for these families as they are now able to forge new relationships that put them at the center and restore their trust. And as we all know, trust leads to confidence, and confidence leads to hope that a better life is possible. I'm happy that so many of you are joining today to dive deeper into a practical discussion about concrete ways to build, leverage, and measure social capital. And as Commissioner Darling has so stated, you know, we need better metrics, we need best practices, we need to ensure that this is working, like any program that we implement, so that we can be faithful to the people who are reaching out to us for help. So we look forward to continuing to learn from all of you on the ground and to continue to partner with Commissioner Darling and the rest of the FSBE team who have really been leaders on this effort. So thank you again for the opportunity to be here today for this important conversation. And as ASBE and our team present today, I'm proud of their work, and I do hope it's helpful going forward. So at this point, I'll turn it back over to Helga and the webinar team. Thank you.
Thank you, Deputy Assistant Secretary Destro and Commissioner Darling. We have an exciting lineup of presenters this afternoon. For the first portion of our webinar, we have two presenters. First, we have Laura Erickson, who is a social science analyst at the Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation, ASBE. She has worked on social capital work for the past 2 years, and she conducts research and policy analysis related to domestic violence, human trafficking, and economic mobility. Laura received her master's in public policy from George Washington University. We also have Sofi Martinez, who's a social science analyst in the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Planning and Evaluation, ASBE. At ASBE, she's responsible for policy analysis and research on social capital and reentry from incarceration. She was a 2015 Presidential Management Fellow and has a master's in public policy from the University of Maryland, College Park. Laura and Sofi, take it away.
Thank you so much, Helga. Yeah, Sofi and I are so excited to be here on behalf of ASBE and are excited that so many of you are tuning in today. And as others have mentioned already, we recognize that relationships are such a critical part of so much of the work that FSBE grantees are doing and that our FSBE colleagues in the main part of the department are doing. So we're really excited to hopefully share some concrete ways that you all can continue to think about, measure, and implement social capital practices. And at our office, we really try and focus on cross-cutting issues that are important to many folks across the Department of Health and Human Services. And so Sofi and I and some of our other colleagues have really been thinking a lot and doing some research on social capital for the past couple of years and are really excited to just jump in. So with that, as we were getting started, John, could you initiate the first poll? So we're really excited to we're curious how many of you are actually using the term social capital in your work, and that'll just give us, I think, a helpful kind of baseline as we're diving in today.
We will, the polls are open, and we'll leave them open for about 45 seconds or a minute here to give everyone a chance to weigh in. While we're doing that, I also want to make sure that everyone is aware, if you click on the drop-down menu that says handouts, there are 3 PDF documents available from ASBE related to their presentation, and you can click to download those at any time during the presentation. So we're coming up on a minute here. Let's give it 5 more seconds for anyone to answer. But at any rate, we'll close it now. And it's 77% of people say they have not used the term, and 23% say they have.
Well, I'm excited that 23% of you have heard the term, and for the rest of you, that's totally okay. That is definitely in line with what we've been learning in our work. So we'll just jump in and go to the next slide, and I'll give a brief overview of kind of how we at ASPE have been talking about social capital. So to us, the idea is really that relationships matter, and relationships can have tangible outcomes for folks, things like information about a job opening or a place to stay in an emergency, or even emotional support in a time of crisis. And research really shows us that people with higher levels of social capital and with these strong connections are happier, they're healthier, they find better jobs, and they live longer. And we also think about a couple academic kind of categories of social capital. So one is bonding social capital with people who are like us. So perhaps that would be connections between youth who have similar experiences with homelessness. Another type of social capital is what we think of as bridging social capital, which are connections with people who are different from us. So that might be a connection between a youth and maybe an adult mentor or a caring adult in their lives who's from a different background than they are. And then finally, we think about linking social capital, which is people in positions of power who have potentially things like connections to employers, for example, in the community. So those are kind of the ways that we talk about social capital at ASPE, kind of from an academic standpoint. But moving to the next slide, I think this work that we've been doing on social capital is really grounded in what so many of you are doing on the ground and in the field. So we really wanted to learn, what are folks doing and how are people building social capital in human services programs? So our office did a project. We looked at about 33 human services programs and did some case studies and looked at folks who we think really are trying to build and leverage the value of relationships in their human services program. And what we found is, like so many of you, a lot of programs are not actually using the word social capital, but they really are doing this work and they really are building relationships. And people often, instead of saying social capital, talk about things like community or support or relationships. Another thing that we learned in this program scan that I mentioned, we learned that programs are really building and leveraging social capital in ways that definitely do not always fit into those neat academic categories that I just mentioned. So while we might talk about bonding and bridging and linking, the lines are really blurred. So for example, you might, if you have a mentor, an adult mentor as a youth, that person might come from your same neighborhood. They might be of the same race as you. So in that way, you have that kind of shared experience or that bonding social capital. But because they're a different age and maybe have a different financial situation, that could be also seen as a bridging relationship. So these categories that we talk about are definitely messy on the ground. We've also seen that folks are often using things like mentoring or peer support groups to build as strategies to build social capital. But often these kinds of strategies are just one part of a much larger intervention that a program might use. So for example, maybe you're providing shelter services to youth, and perhaps you're also providing peer support groups as just one aspect of your programming. So that aspect of your programming might be focused on building relationships between youth, but we really want people to think intentionally about how they're engaging in those social capital and relationship building activities. And finally, very few programs that we looked at are actually measuring or evaluating social capital, at least in an intentional way. And that leads me to the next slide. So in terms of how to measure social capital, so our office at ASPE, we're kind of data nerds, and we really think that measuring your impact is such an important way to kind of make sure that you're conducting your program activities in the best way possible so that you're really accomplishing your goals and helping those that you serve accomplish their goals, and also so that you can demonstrate the power of what you do to other people and kind of communicate that. So we decided to look into social capital measurement, and we interviewed some human services programs on the ground. We also talked to folks at HHS, both on the leadership level and on the staff level, and also looked at the academic literature. And from all of that, what we really learned is there's no one single way to measure social capital. There's not a perfect question that you could ask of your participants to kind of assess their level of social capital that's going to capture every aspect. And what questions that you would want to ask to measure social capital are really dependent on your population. But all that said, we did find that questions tend to fall into three main categories of questions. So some questions ask about things like resources in times of need. So perhaps someone would ask whether an individual has someone to turn to for childcare in an emergency or a place to stay. Another category and type of way to assess social capital is to ask people about their level of trust. So that could be asking whether they have someone in their lives that they trust deeply or if they trust their neighbors. And then third is this other category that's more focused on community and civic engagement and that broader kind of type of relationship and social capital. And so these, the way people measure this is often by asking things like, do you vote or do you have a library card? And to give a really specific example, one evaluation with some youth in the transitional living program asked, upon entry, they asked some youth at a baseline whether they have responsible adults or mentors in their lives who pay attention to what's going on in their life. So I think as far as we understand, this question was really just trying to assess youth's permanent connections with caring adults. So it wasn't explicitly created to measure social capital, but we think that it's such a perfect way to measure social capital. And I think that's a great strategy, is to think about whether you're already doing any data collection that maybe could get at social capital. And moving on to the next slide, if you're not already measuring social capital, a few things that you can think about to do it are, one is thinking about positive versus negative social capital. So of course, as we've been focusing on the positive value of relationships, but we do recognize that some relationships can be harmful, or social capital can potentially reinforce existing networks and even exclude people. So of course, that's something to be thinking about when you're measuring social capital, is to make sure you're measuring the positive aspect of it. You also might want to think about the participants and your program characteristics. So if you're serving a population of folks who are facing immediate crisis, like youth who are experiencing homelessness or domestic violence, it might be especially important to look at their levels of social capital over time, because if they come into your program in an immediate state of crisis, they probably have already turned to all of their relationships and they've really leveraged all of their social capital, so it might be depleted. And in that case, you might want to really look at their social capital over a longer period of time to really get an accurate picture. And then another important thing to think about is unintended consequences of measurement. So of course, we think that it's really important to measure social capital, but we have heard anecdotally, for example, about one instance where a program asked their case managers to document their interactions with clients and how well they were building relationships with clients, but that actually unintendedly it caused some of the managers to focus more on the documentation piece rather than actually focusing on building those meaningful relationships. So that's just another thing to keep in mind. And potentially, if you're thinking about starting to measure social capital, you might want to do additional training or talk with your staff about how to make sure there are no negative impacts. So John, if you could initiate the next poll here, we're curious how many of you are capturing data right now that you think might be able to measure social capital.
Once again, we'll just leave this poll open for 45 seconds or a minute. And I'll just take the time again to remind everybody of the handouts.
Yeah, thank you, John. And in the handouts that John mentioned, we have a number of resources from ASPE. So that includes a measurement brief that talks about a lot of what we're discussing today, and then also a logic model tool that I'll get into very briefly in just a moment before turning it over to Sophie.
Okay, this poll will be open about another 10 or 15 seconds here. We'd love to have as much of a response as we can. This one is a little bit closer than before, but not much. The question is, do you currently capture any data that could be used to measure social capital? And as I close it now, after a minute, we are at 63% yes and 37% no.
That's really exciting that so many of you have said yes to that question. That makes me really happy. And so I hope that you'll think about ways that you can maybe leverage the data that you're already collecting to think about and look at your participants' levels of social capital. And then if we could just move on to the next slide, I did just want to very briefly mention a logic model tool that we have in the handouts available to you all. So it looks a little maybe daunting, but while we might all agree that helping youth form meaningful relationships can increase and improve their well-being, logic models can help us really think through this in a concrete way and think about how your different resources, like maybe your staff's connections with folks in the community or the activities that you're doing, like mentoring, can really help folks actually build their social capital and impact their long-term outcomes to potentially reduce poverty or increase rates of stable housing and things like that. So that tool is available for you in the handouts. And then with that, I'll turn it over to Sofi to talk about some of our other work.
Great. Yes, thank you so much, Laura. And so if we go to the next slide, please. We now want to kind of dive into the 5 principles and 8 emerging practices around social capital building that we've identified through this research. And do just want to caveat here before we delve into these to note that we're calling these emerging practices, right? Not best practices or promising practices. And that's largely because while we have seen some randomized control trials and kind of really rigorous studies and data collection around these practices, a lot of it is based on qualitative work, so not quite at the point of being able to call it more of a best practice yet. So on to the next slide. We'll give you kind of an overview of the 5 different social capital principles that came up when doing this work. And really what this is we found that when talking to experts around their social capital work, these kind of 5 different principles kept coming up as things that, regardless of what type of social capital practice you're implementing, an organization should really kind of embrace these 5 different principles to be able to really effectively do social capital work. So the first one is people at the center. And this means really having participants viewed as the experts, making sure they're the ones driving the goals and services of the organization. The next one is relationships as assets. So just like you view your organization's bank account or your organization's building or locations as assets, relationships themselves should also be viewed as just as valuable assets. The third is staff and participants as partners. So really being aware of any potential power dynamics and making sure that staff and participants are really being viewed as viewing each other as equals. The fourth is cultural competence. So recognizing and being aware that staff, both among staff and participants and between them, they may come from very different backgrounds, and as a result, it's important to be open to different cultural perspectives and really working together on this. And then finally, number 5 is emotional intelligence. So making sure that staff are able to properly navigate their own emotions as well as those of others. So on the next slide, we really delve into the 8 practices. So the first 4, the first one is using cohort models to engage participants. And, sometimes folks call them peer groups, cohort models, those sorts of things. And these we found can really be helpful in empowering participants, because often in these situations, right, when you're having a group of individuals go through a program or services at once, they make bonds with each other and really feel empowered to express their opinions to staff and organizations. And a couple of considerations here are first, to make sure that your cohorts are kind of a manageable size so that people can really make relationships. Often we found kind of these ranges from like 6 to 20 people, much larger than that, and it can kind of get difficult to really kind of create bonds between groups. And also kind of thinking about who's going to be facilitating these cohorts. It can be important that you find someone that knows kind of when to lead the conversation as well as when to step back and let others talk and speak up. And so the next emerging practice is engaging with participants meaningfully through time and or intensity. And in just a few minutes, we'll hear from Roca, who does a really good job of this, engaging participants over a long period of time, and also kind of an intensity of engagement with participants as well. But really, this is about making sure that when we talk about social capital and relationships, it's not just a kind of one-time interaction, right? To really build those relationships, you need multiple interactions, often over time. And the third emerging practice is building and leveraging social capital among organizations to foster individual level social capital. So this is like just how your organization probably has many kind of connections in itself, making sure that you're using those connections to benefit your participants. So instead of, for example, saying to a participant, we don't offer that service, you'll have to go to X location instead. If you know a person that works at that place and you can give them a name and number of a specific person to call rather than just a general line or a general organization, those kind of small connections can be really helpful in helping to build the social capital of participants. And then number 4 on this slide is using technology to build individual social capital. And this is really important, right, often frequently used with youth, as well as now during COVID-19 when we're practicing social distancing, right? It can often be really hard to develop relationships when we're apart from each other, but technology like apps and social media, and as well as just texting or video calls, all of those can be really helpful to build social capital for folks. So on the next slide, we talk about the other 4 emerging practices that we've identified through this work. Number 5 being using data to build organizational capacity in decision-making and evaluation. And so we're going to hear about this more later today, but I did just want to give a couple examples. We know we've heard from the Building Wealth and Health Network that works with TANF recipients that when they did a randomized control trial of their peer support groups, they found that actually folks who did receive those peer support groups had reduced economic hardship, greater earnings, and also reduced depressive symptoms. So kind of with these findings, and if your organization is able to capture kind of some data, this can really be helpful to inform what types of practices are working best, where tweaks might need to be made, that sort of thing. And so number 6 is creating the space and opportunity for organic connections to happen. And this is about really, when we think about kind of the relationships that matter most in our lives, oftentimes a lot of them are organic relationships rather than kind of contrived or forced, maybe assigned relationships. And while this is an organic process, organizations can help to make sure that there's an opportunity for that to happen. So that could be through creating like an actual physical space, like a lounge or something where participants can get together and interact informally, or even just some type of event, right? Whether that's a informal Zoom call during COVID-19 or a dinner where everybody gets together, that sort of thing. Then emerging practice number 7 is including qualified individuals with similar experiences as participants or qualified alumni in programming and staffing. And this can really be helpful to make those connections between participants and staff and really add to the credibility of the organization in the eyes of participants, as well as, of course, helping to inform the organization on kind of what practices would be best. And then I'm going to go on to our final emerging practice, which is emphasizing accountability. And this can be informal or formal, but really thinking about kind of what types of kind of expectations should people have for relationships. So not so much setting mandates, but really more creating an expectation between, how often are folks going to meet, that sort of thing, for how long. So I realized I went through a lot of practices there. I did just want to pause here and kind of get your all's reactions, at least for the first 5 of those practices that I went through, and see if you all are using any of those in your work. So I'll turn it over now to John to open the poll. So here you can see, yes, it's basically check all that apply. If you're implementing any of those first 5 practices, we'd love to hear it.
Once again, we'll leave this open for a minute or so. I also want to remind everybody, I know Helga mentioned it at the outset, but there is that drop-down menu that says questions. And if you have questions for any of our speakers, please submit them there, and we will do our best to get as many of them answered as we can in a Q&A session at the end of the webinar. So we'll keep this poll open for another 10 or 15 seconds. And it looks like, as things sort of even out here, it looks like as I close, 44% say they use cohort models to engage participants, 73% say they engage with participants meaningfully through time and or in. 51% build and leverage social capital among organizations. 46% use technology to build individual social capital, and 47% use data to build organizational capacity in decision making.
Great, thank you so much, and that's great to hear. So many practices are being implemented by you all, and so many potentially are kind of new ideas for you. So on the next slide, we want to talk about some of the available and upcoming tools that we have that might be of use to you in implementing these practices. So next slide, please. So first, we want to highlight some of the complete materials that we have. One is a webinar and a brief on measuring and evaluating social capital in programs. And you'll see that the brief is available in the handout section of this webinar. The next are some podcasts on select emerging practices that feature conversations with organizations around how they're implementing these emerging practices in their work. The next one is social capital considerations during COVID-19 memo, which talks more about kind of implementing social capital during social distancing. And then we have a number of case studies. The one for Roca is also included in your handouts here today. And then we have some upcoming tools, including a toolkit for program managers on emerging practices that'll really go into much more depth on the practices than I went through today. And an ongoing virtual training series on social capital for incarcerated and reentering populations, which we have 2 more trainings for that you can register for at the link. And then finally, some upcoming work we have is around looking at the value of peer supports for reentering individuals and survivors of domestic violence and trafficking. And so just so you know, in this follow-up email that we send out after the webinar, there will also be some other materials in there to talk more about the emerging practices. So be on the lookout for those. And then next slide. And this is just our kind of main website for all of our social capital work, as well as our contact information. Definitely feel free to reach out and let us know if there's anything we could do to help support your work. But with that, look forward to the Q&A and hearing from Roca.
Thank you so much, Laura and Sophie, and a special thanks to ASPE for collaborating with FISB and contributing to this important webinar. Now we'll hear from Anisha Chablani-Medley, who's Roca's Chief Program Officer. Anisha started her career at Roca as a youth worker in 2000 and began running the programming in 2002. Anisha leads Roca's efforts to ensure quality and fidelity in the implementation of the Roca intervention model, including staff development and training. Anisha has been key in the creation, design, and implementation of Roca's approach, strategies, performance management system, and CBT practice. She has over 20 years of direct service experience working with very high-risk young adults and has over 15 years of program and organizational management experience. Anisha holds a bachelor's degree from Boston College and a master's degree in education from Lesley University. Anisha, take it away.
Thank you so much. Thank you, Commissioner Darling and Deputy Assistant Secretary Destro and Laura and Sophie for inviting me to present for Roca. We're really excited to share some of our strategies on using social capital and measuring social capital to help young people move forward. So if we could advance the slide. Just as an overview, we are a mission-driven, obviously, organization, and we're really focused on trying to disrupt incarceration and poverty by engaging young adults, police, and systems at the center of the violence to really address trauma, find hope, and drive change. If you could advance. Just to briefly talk about who we work with, we're really focused on 16 to 24-year-olds who have experienced extensive trauma, and again are sort of actively engaged as the drivers of urban violence or victims of urban violence. They don't have to necessarily want to engage with us. We often are seeking the young people who are not ready, willing, or able to show up for programs, and and really work to engage them. We also believe it's really critical to engage the adults in the public systems that impact their lives, and so who are also at that heart of that violence. And so the public safety leaders, police officers, probation officers, and so forth. And again, what we're really seeking to do for the young people is reduce incarceration, reincarceration, and build skills for long-term sustained employment and improve parenting. And then with our partners, really working on policy and practice changes that really affect the lives of the young people we're talking about. If you could advance the slide. So we have 4 kind of key strategies or in our approach. The first is really about this idea of creating safety and stability, given the trauma and the extent of violence that our young people are engaged in. We understand in order to do anything, right, this is really about creating enough safety and being able to be consistent enough and show up with young people. And we do that through our relentless outreach and our transformational relationships. We're also really committed to building skills that will help people learn how to make the decisions and consider what they want in their lives, but also have those for the long term, long beyond their time at our agency or being with us, so that they can have those skills. Practice is a big part of what we do. It's sort of, we're not seeking young people who are ready and show up and want to make changes. They are still actively involved in the struggle. But also we understand that, you know, patterns and change, our brains can change through long-term repeated practice. And often we don't allow for that in the spaces that we create in the boxes of programming. So we're really committed to making sure that we do that. And then again, the systems engagement, to really relentlessly engage with them, to build those relationships and practices and partnerships that both impact the way they consider and think about and engage the young people that they serve or impact, and to kind of improve the way that they do that as well. So if you could advance the slide. So in the kind of context or framework of social capital, really the bridging is a key strategy for us. Our strategy is really about going out, engaging and building these relationships, to build connection, to create that safety that can help engage young people with us long enough to be able to help support skill building and the desire for change over time, right? So we do a lot of outreach. We go to the streets, we go to their houses, we find them wherever they're at. Again, they don't really have to want to show up or wait to show up, be ready to show up. It's really about how we show up and build with them. And then our kind of our signature tool is really our transformational relationships. So how we use ourselves to build these relationships that are strong enough to actually support change for our young people. As many of you on the phone probably know, there have probably been many failed relationships from people from both in their immediate families, but also from programs and places that have claimed to want to show up and help support them and help them change or you know, provide services, where those relationships just sort of are based on what I can do for you, and we believe that transformation is a mutual process. It comes when enough trust is built, and that it has to be really worked on, and particularly for young people who experience a lot of trauma, who have a hard time trusting and building relationships. We have to carry the front end of that building and keep showing up to build those relationships to get to the point we want them to be able to get to. So if you could advance the slide. The linking part, again, would be our engaged institution strategy here. So we kind of do the same thing we do with young people. We don't leave them alone. We go and relentlessly kind of engage and work with them. Often they don't necessarily want to be involved with us at first, but we know that we need to be involved with them and build with them to create some of the changes that we're looking for our young people and for those systems. And so we show up with our systems leaders. We bring them and engage them in programming with young people. We work on policy and practice changes. But this is, whether it's corrections or whether it's employers or other like service providers, it's really about how we bridge those relationships with each other so that we can help create more possibility for young people to have adults who can show up and support and do something helpful to keep them moving in the direction that they can go. If you could advance the slide. So bonding too, it kind of happens most frequently in our spaces where we're practicing, as I mentioned. So the programming is all designed for our young people to be able to practice and fail and come back and kind of learn together. And we kind of take the opportunity for all this programming to really try to connect people. In this virtual space, as a result of COVID, we've kind of figured out how to use different social media platforms to do online circles, to be able to do some outdoor circles, to be able to still run some programming for young people so that that attachment and connection can be formed, and the growth and learning that they get with each other continues to support them throughout this time of distance. But in this space of being able to actually do some things together and practice and support each other in the change process, the bonding becomes quite significant and supports the long-term desire to change. So if you could advance the slide. So we think we're doing a good thing in theory, and when we put our model together years ago, it was, basic understanding that relationships are at the core of what and the foundation of what we need to make positive changes. That's for any of us in our lives, and without them, it's really hard to make those changes. We also understood we wanted to engage a group of young people who didn't necessarily want to engage with us, and so we're very committed to developing a performance management system that would help us understand how we were doing in terms of engaging our young people. And early on in our data collection and some evaluation studies, what we learned was the single most predictive indicator that we could retain young people and get them to long-term outcomes was our contacts, the number of contacts we had. And it wasn't necessarily even that they had to be hours and hours upon contact, but it was the consistency of contact. And so we laid that right into our model, given that data, and said, everyone, this is the most important thing. And so we also then developed tools for our youth workers to be able to manage and track their caseloads to ensure that every young person got that contact, that consistent contact. For us, the standard is a minimum of 2 face-to-face contacts or actual contacts a week. It can take 8 or 9 efforts to try to get 2 actual contacts. But this sort of is one of the example of a tool of how we are working to build that relationship to ensure that we don't have control over a lot, but we do have control over is our efforts and what we do to build the kind of relationships we know can help support change. If you could advance the slide. We also understood that change takes time and building relationships takes time. And so we sort of built a model that had phases. And the first phase is designed really around building trust with our participants. So again, they don't have to want to engage or show up. So how do we learn about what it takes to build enough trust and relationship that could be that foundation for change? And so again, through data collection, we were able to actually set in some standards based on what was working and what was not working. But in that first phase, we're really looking at how willing young people are to engage with us. The Stages of Change is a framework we use a lot in our work and train our staff in a lot. And so it's really about, you know, when they, in the very beginning, we often seek to serve young people who are in pre-contemplation. They reject us over and over again, and then we build these relationships. One of the things that is significant in our relationship building is that we actually want to be able to have real change conversations and challenge young people to think about change. And when you do that with adolescents, if you're doing it well or at all, often they reject you again and push you away. So there's a relapse in the relationship. But what we found was when that happened in the phase 1, the strength of the relationship sort of gets tested. And for the phase 2, when people are going through significant behavior change struggles, there's a stronger bond there. When there was not much, when there wasn't much push in the first phase, when we're building trust, when the relationship wasn't tested, actually, when people had a hard time with behavior changes like substance use or reducing violence later down the line, we had a harder time keeping them or finding them because there just wasn't that same level of, I think, belief on the young person's part that we could actually do anything different for them. So these indicators that you see in front of you, there's a checklist, this sort of stage of change, willingness to engage. We use this to really look at, are we working to engage young people? Where are they? And actually, we want to see some relapse or testing in the relationship so that we know when it gets really, really hard, the young people understand we're not going anywhere and that we'll be able to support them through that change. We also are really, really committed to a model where young people are attached to additional adults, and it's not a one-on-one sort of relationship, because we want the relationship to be a model itself of the possibility of healthy relationships with others, and to start creating that while they're with us. If you could advance the slide. In the phase 2 part of the relationship, which is about the phase 1 is the first 6 months or so, 4 to 6 months. And then phase 2 really goes from that 6-month period to 24 to 27 months, depending on how they're progressing. We're really looking at then how we use the relationship to support and push change by helping young people kind of do the things that we know will help them and get them engaged in programming that's going to help support them and complete various curriculum and workforce things that are going to help them, and also work on behavioral changes that help reduce the kind of choices that might get them arrested or violating. And so that we track all that sort of stuff. And it's really about, you know, again, how does that relationship that we've built strong enough to engage young people in actually doing things that move toward more positive outcomes. If you could advance the slide again. So the first kind of sets of slides were about how we hold ourselves accountable and look at our work to make sure that we're moving in the direction that we think is important with our young people. We also want to know from them if what we're doing matters and if it's having the impacts. So we do annual participant surveys, and these are just examples of questions that you know we want to know from our young people. Do they feel like they belong? Do we make them feel safe when they're at Roca? And you know, and how so? So if you could advance the slide again, there's just a few more examples. Do they connect me to services outside of Roca? So do they see us as support those linking relationships? They understand fundamentally that we care about them and don't judge and are really there to help support the learning and growth that's possible through these relationships. So these are just more examples of why it matters and how young people perceive it. Could you advance the slide, please? And then really like also getting to, you know, how important getting to changes and making changes in life, and then how confident people are that they actually can make those changes. Because we all know probably people we've been involved with in our own lives, or stories from young people where, you know, they might have gotten excited about a particular relationship with a mentor or a youth worker. They, you know, got excited about making some positive changes, and then that relationship goes away. Whether it's a, you know, youth worker leaves, or they, you know, they just they leave the organization, or they go somewhere else, and the young person is now left with feeling like that change isn't possible anymore. Well, one of the things we want to make sure and do is that the relationships are built that really help people think about change for themselves and build the skills necessary for it, that it's not reliant on the relationship, but that it is motivated and connected to having strong relationships where you feel supported enough to do what you need to do. So if you could advance the slide, John. We also see then that, you know, the end game. The end game is the most important, and that's, are we actually achieving what we hope to, and that young people are not being reincarcerated, and that they're able to hold a job and retain long-term employment. These are the things that are significant for us. And so we look at this kind of data too. So, you know, how is that relationship all throughout their engagement over the 2 years? And then we maybe, you know, another, we often work with young people for a 3rd year and up to a 4th year to support that transition and change. But those relationships really are, you know, the key lever that holds people in. It has to be in the direction of impacting young people to be able to make the decisions and choices and have the skills that help them reach these outcomes, right? So that they're not getting incarcerated and that they can confidently hold a job. So this is sort of, you know, why these matter. Again, for us, it all starts with the relationship and how we seek to engage and spend the time engaging young people where they are, even with the rejection and resistance, because we fundamentally know that that we all need relationships, and that it is absolutely at the heart of both change and healing. So, John, if you could advance, I think that was my last slide. So happy to join the rest of the team and answer any questions there.
Thank you, Anisha. Yes, we're going to shift gears now to respond to some of your questions.
We have a number of questions already here, but I just wanted to reiterate that for anyone who still wants to ask one, you can use the questions drop-down menu in the dashboard there. We've got quite a few. We're gonna do our best to get to all of them. We seem to have, you know, a bit of time here. I'm just gonna run down and see. There's one question here for everybody. Does it count as social capital if agency staff are the individuals that clients are identifying? So individual, if your client, if your staff are the people that your young people are identifying as their social network, does that count as social capital?
Yeah, well, I could just jump in here, and then others can feel free. I think this is something that we've kind of thought about and contemplated over time, right? Because of course, someone, right, thinks like, if it's a paid relationship, is it as valuable as kind of a non-paid, right, kind of more organic relationship? And I think what we've found is that, others feel free to jump in, but you know, those relationships still are valuable, even if it's staff. But of course, making sure that participants have relationships beyond, healthy relationships beyond just those with staff can also be really important, and kind of key to making sure that it's not just the relationship with your, you know, maybe paid mentor or caseworker or something, but also that you have other relationships that are being developed that can help you as well.
Yeah, I
Excellent.
would just add to that that I think Sophie's exactly right. And it's a great question because it really is something that we've grappled with a lot. But yeah, I do think that all kinds of relationships are valuable. And so while those, staff relationships with staff folks might be slightly different, they still definitely have merit and have value.
Yeah, I guess I would just add in too. I mean, I think that the idea of building relationships versus case managing is sort of a differential here, and what the approach is. I know for our staff, most of us live in the communities we serve. Most of us have contact with young people way outside of all sorts of regular kind of business hours, and those relationships are they're formed. They're not singular, but they're part of a modeled network, right? It's and not all staff stay at the agency forever, but they actually stay attached to those young people more often. And so how we help support the development of positive, healthy, bonding and linking relationships that help young people beyond the agency's scope, even if it's with the agency staff, is really critical, I think, in how we design our thinking and actually set it up for it.
Thank you all. I will move on to the next question. Do you think there is a benefit to youth to have programs teach relationship skills as a means to build social capital?
So I can just jump in if I'm not sure how we're answering all of these, but for our population and the age group, we teach skills around like interpersonal skills that support positive relationships, but not necessarily relationship skills. It's really though the opportunities to practice and engage with people and build, right? I mean, it's one thing to kind of sit in a classroom and do a group and teach relationship skills, and then it's another thing to kind of create experiences where people can actually practice and engage with people in real meaningful ways that actually create the kind of, I think, social capital or relationships that you're thinking of, where it goes, the benefits extend way beyond and actually impacts outcomes. So I think it's about how you create experiences where people can have the opportunities to be in those relationships and engage and use the kind of skills that help support healthy relationships.
There's I'm sorry, was there another answer coming? Okay, there was another question. A few people asked about this term negative social capital. Can we just go back and define that aspect, that idea one more time?
Yeah, I can start on this one, and others, again, please jump in. But I think for us, at least at AFSCME, we definitely recognize that some relationships can be harmful. And so we're really trying to focus on, I think, what we see as positive social capital would be the relationships from which you could get positive outcomes, and those connections that have benefits. An example of negative social capital may be like if social capital, if there's a really strong kind of in-group network that actually ends up excluding people because a group of similar people don't want to expand their relationships and maybe let someone who's different than them into that network, that would be an example of maybe negative social capital. Or I don't know if Sophie or Anisha, you have other examples, but at least that's how I think about it.
Yeah, I guess the one other example I'd add, I think, is definitely that example that Laura mentioned, and we've kind of seen that sometimes in, right, people I think hear about it in like the workplace, if someone, oh, that's their friend, so that's why they hired them, that sort of thing. Or you can also see it kind of, we hear about it with like gangs or substance use, those sorts of things that can also kind of encourage negative outcomes, right?
The next question comes timely. What ideas do you recommend for creating spaces and opportunities during the time of COVID?
So I mean, I can just share a little bit about what we've done for our young people. When we went at first, when we were fully like remote and in quarantine kind of mode, youth workers and educators and other staff rapidly tried to figure out how to use social media spaces to bring young people together in groups, closed groups. But you know, we did a lot of that. There's still a lot of social distance outreach that we would do, meaning like we'd go out and do the outreach, find people, but like not go into the homes or be transporting people as much. The other thing is, you know, at least for some of our young people, their lives, the way they, how do I say this? So they were doing the same things they were doing before the quarantine and before some of the issues that came up, because some of their for them daily living is pretty extreme as it is, and sort of you know, number of young people still out on the block, out on the corner doing the work. So the youth workers, again, go to them and try to create opportunities for some different kind of conversation, different kind of learning. And we've really worked on trying to think about what tools do we equip people with to do that. How do we train our youth workers and our educators to be able to go take programming out to people and get out of this idea that people have to come in and sit in a, you know, in a group and learn together in a certain way. But how are we taking these things to people? How are we creating virtual lessons? How do we create tangible, short, skill-based lessons that we can take and leave with people? But I think it's about trying to get very creative right now and get out of a lot of very just of the regular program boxes that we get stuck in about what it looks like, and try to use every opportunity we can to use ourselves, and then to use the spaces where they are or where we can get them to, whether virtually or physically, safely, to help practice something different.
Yeah, and I would just add to that that we at ASPE have been trying to think about that too, and kind of talk, of course, to folks on the ground, because we definitely are not the experts, and we've been learning from folks who are doing this work meaningfully. But I think some of the things that we've heard is that, of course, there are so many, in many ways, additional barriers, and as kind of Anisha touched on, like things just look very different right now. But we've been trying to think about maybe some of the benefits of it, and so of doing things virtually, for example. So instead of doing, like, you might do a family dinner type of thing with participants and alumni in normal circumstances, now maybe it's a kind of a group video chat, or maybe you're doing your peer support calls over a secure video platform. So it definitely looks different, but I think folks are trying creative things. And we've even heard, like, I think some groups like sending out different kind of arts and crafts type activities to folks, and then using that to kind of be the thing that they are doing while they're on their video calls with each other. And we've even heard that, you know, in some instances, it actually can be beneficial to do things over technology, especially for maybe like young parents who sometimes might not be able to come to an in-person activity, are actually now able to attend to kind of online and virtual events because it's a little bit easier than trying to find childcare. So we've been trying to think of at least some of the positives of this unfortunate time.
There are a couple questions here about getting the slides, PDFs of the slides here. So I wanted to let everybody know that an email will be coming to all of you from GoToMeeting tomorrow that will include a video of this entire presentation, as well as the slides from this to share with the people in your group. So thank you for your interest in that. We will, those will be coming to you tomorrow. Another question here about negative social capital for clarifying. How How is limiting or marginalizing affiliation assessed? And how can researchers be sure that their assessments are culturally valid? Examples: peer associations around sexuality may or may not be marginalizing. Values such as employment or economic contributions may or may not be culturally centered.
Sorry, I was trying to unmute myself, not turn off my video. So yeah, I think there's definitely not, again, as with what Sophie and I were talking about earlier, especially with the measurement stuff, there's not one great or perfect solution. I think it really is dependent on the folks that you're serving. But I think if you're trying to measure social capital and figure out if you're creating positive social capital or helping your participants leverage positive social capital, just be thoughtful about the way that you're framing your questions. So it might not be, so like if, for example, if you might want, like as it sounds like this question acknowledged, you might, it could be really powerful to have connections with folks who are like you, who maybe have, who have a shared sexual orientation or something like that. So you can kind of, I think you could kind of direct your questions in such a way that would ask about the positive impacts that folks have experienced from their relationships. And then you could also think about asking participants if any of their meaningful relationships have had negative impacts. So I think you can kind of try and get at that in the way that you ask your questions. But I think that's really nuanced, and others might have something better to add.
Okay, we have a little less than 20 minutes left, so hopefully we will get to as many of these questions as we can. One thing I am going to do is advance to the next slide, or the next slides, which contain some resources from our partners and our speakers here today. So we have a couple slides worth of resources. I'll just sort of move through these over the next 20 minutes so everybody will have plenty of time to take a look at them as we listen to the answers. For our next question, someone has asked, we have struggled with clear conceptualization around absent social capital versus negative social capital. So for example, in recovery circles, when someone is in recovery and has social relationships with people who are still using, they may have social capital, but it is negative versus absent or a lack of capital. How do you think about and conceptualize this?
Yeah, well, I could jump in, and then others feel free. But I think often when we think about kind of the absence versus negative social capital, when we think about absence, it's more around kind of just not having those relationships in general. And then, right, negative social capital would be more of having relationships, but them not really being helpful to your life or to your kind of the goals that you're trying to achieve. So I think those are kind of the main difference in which we see that. So right, the example that the person gave around kind of being in a support group and are still having connections with people that use substances, right? If those connections are encouraging you to use substances, then that would be an example of negative rather than absent social capital, I think, in our kind of framing.
There's another question here. Can you recommend some readings or research on social capital, in particular, ones that could help us speak to the importance of this to funders and policymakers?
Well, not to plug our own, go ahead, Debbie.
No, go for it.
Not to plug our own stuff too much, but on our ASPE website, on our social capital landing page, we have a bunch of resources, some that we talked about today. We have the brief about the importance of measuring social capital, which includes some of the stuff that I talked about earlier. We have some memos that talk about the research on social capital, looking at how the connections between social capital and economic mobility, for example, and then some examples of research around different types of peer support, so looking at peer mentors, peer support groups, and peer navigators in a bunch of different human services issue areas. So those are just a couple examples of what we have on our site. And then a lot of the stuff that we have, some stuff that we have forthcoming. We'll also have a number of examples of literature that you can look to, both our own stuff and what we've drawn from. So I would, yeah, that's just a long-winded way of saying we have tons of stuff on our site. And if folks have specific questions, I would encourage you, Sophie and I would be happy to, depending on what you're interested in, if you wanted to email us and tell us what your specific interest was, then we might be able to recommend some resources that we've turned to in doing our work.
There is a question here. The social connections we find most important are intergenerational natural supports, which they define as the existing relationships youth facing homelessness already have with caring adults in their networks. However, these connections are typically underestimated and under-resourced, so we advocate for investing in them. We see organizations typically focus on stranger match or program match relationships, and I just want to, AKA bridging, or on connections with staff. What work have you seen addressing intergenerational natural supports?
Yeah, so I think one of the organizations that we've learned about through this work is the Family Independence Initiative, and they work together to have circles of individuals from the same neighborhood or kind of area get together I believe it's weekly, and kind of support each other on their goals and how they're progressing. And oftentimes, right, at least one or two people know at least one or two people already in that group. So I think that's kind of a good example of how, and they've done a decent amount of research as well around kind of the value of that model. So yeah, and I think oftentimes we've heard, especially for like cohort models or things like that, it can be really helpful if people already know a few people in the cohort model, and kind of to help develop those relationships with strangers and further kind of the bonds that they already have with folks.
Yeah, and I think Sophie, correct me if I'm wrong, but I think in some of the work that we've also done looking in their reentry space, I think some programs, I can't remember off the top of my head, but I know some programs really encourage folks to try and make connections with their family members and things upon reentry, and really focus on the importance of that, if I'm remembering that correctly.
Yes, and I also don't remember which specific one, but yeah.
Just to add to, I mean, I think there are processes like or tools that might be helpful to be used. So with our population where there are family members who are willing and available and want to engage and show up, we use things like peacemaking circles. So we've been trained in a circle making process that really is about bringing people together who are important in the lives of the young people that we serve, not just, from all parts of their life, right? And, I think in doing those kind of using those kind of processes, both with people who are staff or from the community or family or other adults who are engaged in the young person's life, it actually really supports the young person and pushes everyone else to figure out how to be able to show up for that young person and for each other differently, is what we found. So like we'll do circles in a kitchen, or we'll bring people in, or we've started learning how to do them virtually to support young people in that process and help strengthen those connections. I think part of what is important is whether the relationship is with a staff person or a family member or a mentor, it's what are we equipping people with to build and strengthen. And so, I mean, I guess going back to what the earlier question was, are you teaching relationship skills? I mean, I don't know, but are we using tools and techniques that help naturally strengthen the relationships that people can have where they are, and how do we do that, right? Like, how do we actually use the opportunity to do that? Because it I think that is it's all learned stuff that we can work on and get better and stronger at, and help move for young people and for their families. But so I mean, I think it's the focus of where and what we're trying to do with them sometimes, and how we bring them into the picture, for us anyway.
Okay, with a little less than 10 minutes left here, the next question is, when thinking about grant cycles often replicate cycles of building social capital with participants and then damaging social capital when those grants and programs end. Do you have thoughts on this, or what to think about when writing grants and implementing 1 to 2 year projects to avoid this kind of disruption and harm?
So I'll just speak from the program perspective and project side of what we did when we decided to move in this direction of having a very relationship at the core based model. We designed the model, we decided what we wanted it to look like and how to do it. And then we started trying to find the funding to make it happen, right? Like, and you have to sometimes think about what funding kind of meets what piece, as opposed to it's going to end the relationship, but like what part of our model and our relationship development and our effort here and getting to outcomes does this cover, right? So like, for example, there are funding sources that might pay for, a project for young people and want to advance some educational outcomes. Well, we have to like look through we don't apply for it unless we have a large enough group that we actually could get to those outcomes if there's a time limit on what those outcomes are, or what that funding is, or we apply only for that slice, if you will, like it's a different cut of the cohort. And I wish it was different. I do. And if we can advocate for funders to understand long-term, multi-year, with the same person, right? Like that it's okay that the same young person is, engaged for multiple years, because, particularly when you're serving hard to serve populations, it's detrimental to only serve them for a short period and then have to cut them loose. But we also have to be, I think, really resourceful and adamant and rigorous about how we think about what that continuation of funding looks like. And so we've had to, piece different pieces of funding together to cover different parts of it. And anything that's more like heavy outcomes based, it's how many people do we have who are deeper in the model, who are in that sort of behavior change phase with who we can actually get towards some more substantial outcomes, and who's gonna like kind of fill in the front end of like the building phase. So, it's not probably the answer anyone wants to hear, but I also think once you get a vision for what you want it to look like, and then having to find the funding to pay for parts of it, as opposed to and making it whole, as opposed to believing in something and only being able to do a short part that might actually cause harm to a young person because it has to end, or we think it has to end, I think is, the alternative.
We have a number of compliments for the presenters. I just wanted to point that out for them about the presentations, and also about the data and the numbers, and specifically the data that Roca has. There's a couple quick questions about that data. One says, I may have missed this, but how long was the data tracking for Roca? So there must be a quick answer for that, Anisha.
So young people, we track the entire time they're in. It's the long-term outcome data. We look at everyone who's been enrolled for 18 months or more, because we don't actually anticipate them getting those kind of outcomes early on, because it's not where they are in behavior change. And then the performance management data is for everyone. It's in an ongoing basis. We use it to look at and manage weekly where we are in engaging young people and how we're using our relationships and programming to kind of keep young people on track because of the fact that those long-term outcomes are so far out.
Another question asked for tips for training and supporting staff to consistently collect this level of data.
So we actually made the front end as easy as possible for people to enter, and we do extensive training when people come in, but people get supervised weekly. They have to enter their data, and they have to bring stuff into supervision. So we're kind of building it into just part of what the process and the routine is, but also making sure there's structured time built in for them to do the data entry we want. But the most important thing that resonates and that we have to help people understand, like, we're not tracking numbers for numbers, right? It isn't about actually how many of these did we do or how many that, like, if we only had 84% contact, that means there were a number of young people who we didn't see, and what's happening with them and what's going on and why, and like being able to coach and understand what's going on. And so connecting that the data is about every single young person we serve, and getting staff equipped to use it to think about and manage how they're engaging and to stay on track with kind of how we need to pay attention, particularly in building those relationships, is sort of an ongoing coaching process.
Well, we are coming pretty close to the deadline here. So to be honest, I think I want to turn this back over to Helga to maybe close us out and just say thank you to everyone who answered questions. Once again, you'll all be receiving an email tomorrow that will have resources as well as ways to contact our presenters and see the slides and the video of this. So there'll be plenty of opportunities to revisit this material and acquire more from our speakers and panelists as needed. But I'll pass it back to Helga now to keep us on time.
Thank you, John, and thank you all for joining the Connecting the Dots Using Data to Measure Social Capital and Build Social Connections to Vulnerable Youth webinar. We will definitely let you all know when the recording is available online on the website, and wish you all good health and all the best.